My name is Devin. Hope y'all day going good, mine going all right. And today I'm going to be presenting my research on how blood and biomarker testing is becoming a powerful new tool for diagnosing concussions, for athletes specifically. Concussions are extremely common in sports and everyday accidents, but they still hard to diagnose quickly and accurately. Right now, most concussions evaluations rely on symptoms or a CT scan. The issue is that CT scans only show structural damage, and most mild concussions don't appear on them at all. That means people, especially young athletes, can walk away with a concussion that goes unnoticed, which increases the risk of a slower recovery or long-term complications. Blood biomarker testing offers a safer and faster alternative. It looks for specific proteins that the brain releases right after an injury. Most mild TBIs don't appear on imaging. Symptoms like headaches or confusion can be delayed. 2 biomarkers rise after injury, and that means GFAP and UCHL1, or that's what it gives off. These give doctors objective data, not just symptoms. Visual, CT scan versus biomarkers. On the left side, the CT scan shows only structural damage and uses radiation. On the right side, biomarker proteins GFAP and UCHL1 rises quickly. Blood tests detect concussion-related changes earlier on. Research process. Reviewed CDC, FDA, and peer-reviewed journal research. I also use UL's Dupree Library database to find some answers. I also compared CT scans versus biomarker tests. I use its accuracy, speed, and safety. And I also use GFP and UCHL1 to predict CT scan results with 95% accuracy. Some key findings. GFAP and UCHL1 are the most reliable approved biomarkers. Blood tests are faster, safer, and potentially cheaper. ABOTS tests common in hospitals, but limited in small clinics. Conclusion. Biomarker testing can revolutionize concussion diagnosis. Faster results and less guesswork. Better for young athletes and high-risk groups. More access could protect athletes long-term. Acute symptoms. Feeling confused, feeling disoriented, and or feeling dazed are some acute symptoms. Also, you can feel physical symptoms like headaches, nausea, dizziness, balance problems, vision problems, sensitivity to light, and or sensitivity to noise. Cognitive symptoms, feeling slowed down, mental fog, difficulty, and or concentrating and or memory problems. Symptoms such as uncharacteristic emotional liability and irritability. Some clinical signs are loss of consciousness immediately following injury, altercation of mental status immediately following the injury evidenced by reduced responsiveness or inappropriate response to external stimuli, slowness to respond to questions, agitated behavior, inability to follow two-part commands, disorientation to time, place, or situation, complete or partial amnesia for events immediately following the injury. If post-traumatic amnesia cannot be reliably assessed. Lab findings. Some cognitive lab findings are cognitive impairment, balance impairment, oculomotor impairment, or symptom provocation in response to vestibular oculomotor challenge. The fourth one is elevated blood biomarkers or intracanal injuries. Thank you, everybody. That is my presentation of biomarkers and how they can help concussions and how they can point out concussions in athletes and so far as other people as well that are not athletes. Thank you and have a good day.